So, I'm 5 weeks post-surgery, and this week I finally had my follow-up with the surgeon, which instead of being the usual 2 weeks ended up being 4 weeks after the surgery, because the appointment has to be cancelled because of the snow. Not ideal. However, I wasn't too worried. I've had no real issues in terms of movement and pain and stuff, so I spoke to the breast nurse and was happy to take off my own dressings and my own steri strips because it all felt fine. And when I revealed them, as you can see in the little reveal video, if you want to watch it, it was very clean, very neat, just a simple little smiley cut just under my armpit here, about, I don't know, 3 inches long or so. Yeah, so all good. I still have a fair bit of numbness. Down the back of my arm there's still a strip, and the back of my armpit here, that's still pretty numb, and in my armpit it's getting better actually. Today I've woken up and everything feels a bit more normal, less solid. So yeah, going quite well in that sense. So on to the appointments. I don't know, I think I was expecting quite a lot from this appointment in terms of what was going to happen going forward. But actually it literally is a post-surgery appointment. Of course, my doctor is my surgeon, he's not the oncologist, he's not the geneticist or anything. So he asked me how things were going. He straight away told me that he was really happy with how the surgery had gone, that he'd taken out a good enough boundary around the cancer so that we didn't have to go back in, and more importantly that the lymph nodes were clear, so it hasn't spread, which is great news, which of course I was kind of, you know, not expecting, but I felt quite safe about because we had caught it so early. So that was good news. That said, I don't know, it wasn't until other people told me, oh, that's great, that's really good news, that it really registered with me that it was good news, because I'd kind of been left feeling a little bit flat, having expected quite a lot from this appointment in terms of, like I said, plans and what was going to happen next. But actually, I've got my geneticist appointment in 2 days' time on Monday. And then I have to wait to see the oncologist, and it's really the oncologist who has all the answers and all the why are we doing this and how are we doing that and what next kind of stuff. So the surgeon has told me that the radiotherapy will be going ahead, well, obviously, unless I didn't want it to, which, to be honest, I don't want it to. I was going to see if I could get out of that one, because if it was just a matter of having it for the sake of having it, just to really be on the safe side, then I was considering not having radio. But he informed me that there's at least a 30% chance of it coming back if I don't have the radio, so I'll be having the radio. Tamoxifen, highly likely one as well. Chemo keeps getting mentioned, but, well, it depends what the geneticist says, really. I don't think it's necessary for this particular cancer, but again, it's what the oncologist says, so I'm not expecting it, but obviously they have to tell you these things because they could be on the cards. So fingers crossed for that one. Update on my cording, my scarring. So I mentioned it to the nurse and surgeon, and they just said keep doing the exercise that I've been given and trying to stretch it out more, because what it is damage to veins. So not important veins, just minor veins. Blood stopped flowing through them. They've sort of basically dried up and turned into these little tight strings. So while it's in this early stage still, you can sort of massage them and stretch them out and get them back into position as such. Or sometimes if they're a bit far gone, apparently they pop, which sounds horrendous, so I I've been making sure to do lots of exercises, and I can. It's this sideways move that I can't do very well because I've got to pull from here down. It feels really tight. But that said, I can't really feel the cords anymore, so it's obviously done some good. So always do your exercises, people. Other than that, back at work. I've been back at work for 2 weeks now. And now it's a bit of a waiting game. Geneticist to balance my risks. Then waiting for the oncologist in the next 4 weeks. Final follow-up with the surgeon in 6 weeks. And about that time is when I'll be doing all the radio stuff as well. So I'll update you after the geneticist appointment.